So as we think about this, though, again, what are the questions you're trying to answer? One of the things we've focused on a lot over the last few years is this idea of increasing transparency and integration. How do we integrate across different environments? So in the health and human services arena, we're very much looking at how does the same population that's needing social services, needs health services, needs behavioral health services, needs education, how do we coordinate and integrate across those? So understanding that and the transparency in terms of how are we spending tax dollars? What are the services we're providing? The presentations earlier this morning were fantastic. I mean, so yeah, I already went and got the Caltrans application. I'm like, yeah, this is cool. I'll download it. We are looking for information, and the public is expecting us to be more transparent, and they don't understand that we still have these archaic systems that maybe sit in the background, and they think data should be available right away. But it takes time to move through there. So transparency, both in terms of understanding what you have and understanding what you don't have, are also really important. So that's one of the things obviously driving analytics. Measuring progress on goals. You know, the question was asked earlier, how many of you have a strategic plan? How many of you have liked your strategic plan? I think one of the real challenges around strategic planning is having goals and objectives that you can measure and you can report on. Part of my role at Department of Public Health and when I was there was around the strategic planning for the department, so I did a lot of strategic planning. And one of the things that we tried to focus on was having goals that we could actually measure, which meant having data for those goals and objectives. And that it was not uncommon for folks to come up with an idea for a goal and objective that we had absolutely no data for. Have you ever been asked to report on something and you're like, I just don't have a data source? It's really hard, right? So helping folks think about the data that you do have and how can you turn that into an objective to get at what you're looking for is also another thing that's really important. Staff and partners. We have our existing staff, we have our existing resources. You know, it was mentioned, budgets probably are not increasing, we know that. But we have a lot of things that we can learn and we can relearn. So one of the things that I've been really involved in over the last several years is the HITECH Act. Just out of curiosity, has anybody heard of that? It was part of the American Recovery and Reinvestment Act. It stands for Health Information Technology for Economic and Clinical Health Act. It's kind of a mouthful, so that's why we call it HITECH. But that really was the driver around automating healthcare, bringing technology into healthcare. And so a key part of that was, again, retraining the workforce. It's not just about, here's a computer, you obviously know how to use it, right? It's how do you literally do your work differently when you have a computer in hand. And one of the things that I think we're all facing as we're moving forward, we have folks that are now going through school, coming out of school that have lived in the digital world, and then we ask them to come work with us where we don't have a digital world, or it's an in-between digital world. And it really challenges to keep people motivated and engaged and help us continue that transition. So how we partner and set expectations and manage that is also incredibly important as we think about analytics. And often those folks may have some really great ideas that we haven't thought about if we've been here for a while. So keeping your eyes and ears open. And finally, this idea about turning data into information. So again, we have a ton of data, and I can post data up the wazoo, and it still doesn't mean anything. If you see a data file, and here's 170,000 NPIs, provider numbers for the 150,000 providers in Tanya's database, it's still really hard to do anything with that, right? Until you can turn it into information and get your hands around it, that's when people start to be able to make it actionable. And so when we think about this idea of analytics informing decision making, it gets to this idea, how do you take all that information, actually make it consumable? You know, our brains do really well with about 3 to 7 priorities. The reason the phone number is 7 digits is because that's what brains can memorize. The reason we push you to say no more than 3 to 5 priorities is that if you have more than that, they're no longer priorities. It's just more than you can keep track of. So keeping that in mind when you're thinking about your data analytics and what can you focus on is something that will really help you down the line. So in terms of thinking about tools, one of the things that we've been working on with the Health and Human Service Agency has really been driven by our open data work and our governance activities within the organization. And a couple years ago now, we've had it for over a year, so we're starting to think about version 2.0, is our data playbook. And the idea around this was to help have a tool that we can put in folks' hands so you can start to think through this idea. Okay, I've got all this data, I've got some questions, how do I get the questions and the data together to get to answers? And so we structured it around this idea of having a playbook, and you go through the plays. So first, define your goals and objectives. Assess, what are the tools and capabilities you have? Data sources, staff, tools, etc. Implement. Plan and strategy, and then evaluate what happened when you did it, outcomes and impacts, and then share. And that, of course, being a really important part. Share your progress and results, both the things that worked and the things that didn't work. Because if it didn't work for you, then maybe somebody else can avoid that problem in the future, right? So we have our playbook. It's on GitHub. It's totally available to the public and everybody else. And we keep adding to it. So it's essentially a high-level idea of when you have to think about this idea of data analytics, what are these steps you need to think about? And then what we're doing is we're adding tools to that playbook as we develop them. So for example, one of the tools we've added to that is the data de-identification guidelines we've developed for the agency. And so we have a lot of confidential data in government. In order to release it publicly, it needs to be de-identified. And so the guidelines that we wrote really are based on the California Information Practices Act. So all of us in California government, we generally fall under the Information Practices Act. So again, we've put that also, the guidelines are out on GitHub, and we welcome folks to use them, leverage them, harvest them, what have you. So this is a playbook that we've been working on, and again, it's continuing to grow and develop, and we'll continue to do so. And we're very open and interested in input and suggestions for improvement. As I mentioned, one of the drivers around the open data, or excuse me, the data playbook was our work around open data. And so this was actually where we kind of started as an agency in this arena, was around the idea of open data. And just to check, how many folks have heard of the open data initiatives one way or another? About half, a third. So there was a strong drive from the federal side. The White House under President Obama was really driving this open data initiative. There was a lot of work at local, and states have picked up this mantle around open data. And the idea is that, again, we in government have a tremendous amount of data. We're really good at taking it and putting it into a PDF and posting it. But that's not necessarily as usable as it might be. So the idea around open data is not just to make it available, but make it available in a machine-readable way so that it can be reused. And we started our open data portal in the Health and Human Service Agency. I guess it's been a little over 2 years ago now, almost 2.5. And we have almost the entire agency has data sets on it. We have over 200 data sets, 93,000 users in 2016, and it keeps growing. And so all of our departments we keep adding. And the beauty of it, though, is that the data is API enabled. So one, you can download it, you can filter it, you can embed visualizations on other websites, and people can write applications and use it, and they have. So it's been a push not just to make data available in some form, but in a form that's then usable. And that then opens this analytic idea up more broadly. So there's an aspect where we're going to do the analysis, and there's an aspect where we're going to make it available so other people can do the analysis in terms of their audience. It's really hard for us to be everything to everybody, so sometimes part of our role is to make the tools available for others to help answer those more specific needs, communities that need to hear it a particular way for it to make sense. So these are some of the things in terms of having our data on the open data portal that have been happening, both engaging with the public through the idea of codathon events, as well as, the other one here, the crowdsourcing data hygiene. Have folks heard the term data hygiene at all? Some yes, some no. The idea is we collect a lot of data, right? And Tanya, I think, mentioned this earlier too, but just because you collect it doesn't mean it's accurate, right? So maybe it gets keyed in wrong. Maybe somebody hand wrote it and you couldn't read it when you retyped it, so you guessed. Maybe they, whatever, right? So data hygiene is the idea that we have data quality issues. And there has been a significant fear around making data available because, well, what if it exposes that we've got a data quality issue and it looks like we've done something we haven't, right? We all worry about that and being on the headline news for that reason. But part of the approach we've taken has been to start with data we're already releasing, make it more readily available. And one of the things we found is we've had folks come in and say, hey, my data's wrong. And we said, great, we're really sorry about that. Please contact this phone number and they will help you correct that. And then when we update the data, it will be right. And so then, whereas if we hadn't made it available, nobody would have found the problem and we never would have fixed it. So the idea of saying it's okay that there might be issues and we'll let people help us find that and then we'll fix it. And then we'll own that we were able to fix it. And so, again, to try to create that partnership there. And so that's that idea around crowdsourcing data hygiene. And we've seen that play out several times. Just as an example, again, in terms of the idea of taking data and embedding it, so for Medi-Cal, our Medicaid program here in California, as Tanya had mentioned, we have over 14 million members now. This is a visualization where we loaded the data on the Open Data Portal, we created the visualization, and then we've embedded it back on our main website. So this is an example of data analytics, turning a vast amount of data into something that you can consume. And what you see is that it's a somewhat flat line until January 2014 when the Affordable Care Act and Medicaid expansion kicked in, and then there's sort of this steady upward trend ever since then. And part of that is because both we have the Medicaid expansion population, and then also there's a lot of folks that didn't know they were eligible, but because they were coming in for some other reason through Cover California or what have you, they found out they were. And so some of that increase in eligibility is just finding more people that didn't know they were eligible for the service. And the split here is those of the members that are in fee-for-service versus managed care, and you see it humps and then it flattens out as well. So again, still a very large fee-for-service population. When we look at it, the 2.5 million people in fee-for-service are about the 8th largest Medicaid agency in the country, just because California is that much bigger than most other states. So the one other set of tools I want to pass on to you here as we finish up and have time for questions come from HIMSS. Has anybody heard of HIMSS? So again, I can tell I'm not in the healthcare population. It's okay. So HIMSS stands for Healthcare Information and Management Systems Society. It's basically the IT organization of healthcare. They have an annual meeting that I think has more than 10,000 visitors every year. It's huge. I've actually never been yet. It just happened a week ago. But they do some really nice work, and they've got some really nice publications around the idea of dashboards and what do you need to think about. And so dashboards being that kind of endpoint information that come from data and data analytics. And the thing that I really appreciate about looking at that as a tool to help this conversation is that folks, again, will often come in and say, hey, look at this really nice, flashy, cool thing. Don't you want this data analytics thing? But they leave out all of the really hard work that leads up to getting to that point and what it takes to maintain that. And so these kinds of tools are useful in terms of helping to have that conversation in your organization about, well, what does it really mean to do this? It's not just purchasing something. It's a whole infrastructure in terms of your work that goes behind it. So the idea of are you ready for it? Business process readiness. Do you have the data? Do you know the calculations? How are you going to sustain it? How are you going to use the data once it's presented? You know, data for data's sake is not what we're here to do. We're trying to use it for something. The idea of benchmarks, targets, and then, of course, change management, because everything is always changing. And it's this idea that it's a continuous circle, that there's these things that you need to address, you know, policies, standards, responsibility, who's going to do what, procedures, mechanisms, and metrics. And the idea that it's a continuous circle, that you're always doing this. And also the idea of maturity. And how many of folks have heard of CMMI and maturity index? A few. And it's one of the things that talks about this idea of maturity within an organization. And so in terms of thinking about dashboard, it gives it that kind of context too. Again, it's everything from realizing you need some sort of dashboard or scoreboard to managing it where you implement a scoreboard. So now you start to collect metrics. a more defined level, level 3, realizing and correcting data errors and implementing more horizontally. Quantitatively managed, level 4, metrics are really well defined, they're understood, and they're collected directly from source systems. And then level 5, optimizing. So you stop focusing on the dashboard, and now you're focused really on the metrics that exist there, and using those on a routine basis. And so I'm sure if you sit and think about kind of your organization, there's probably different parts of the organization that might be different levels of this maturity pathway. But it again, it helps give more structure to the conversation as opposed to somebody just saying, we want data analytics. And then you can say, well, what exactly do you mean by that? Are you talking about this aspect or that aspect? And that then escalates your ability of being successful because you've normalized your expectations between folks, because we see this all the time, right? This person says word A, this person says word A, and they meant two totally different things. So there's some of these words that are horrible for that. Analytics, business intelligence, dashboards. Never stop. Anytime somebody uses one of those words, always ask a few more questions about what they mean and what they're referring to, so that you don't end up going down those rabbit holes of miscommunication. So just in some closing thoughts, how do I get to analytics-informed decision-making? Looking for tools to help support consistent approaches, and again, that's where some of these tools can really help you standardize your language and make sure you're really talking about the same thing. Focusing on business needs to drive the analysis. What are you trying to accomplish? And then, there's that great phrase, what gets measured gets done, and variety of versions thereof. So again, if you're measuring it, it's likely to occur. And so what are you trying to get done? Figure out some way to measure it, and that will help you drive that quality improvement. Investing in training and change management. Using information available, good or bad, to inform and support your decision making. Sometimes, the data's telling us it's getting worse, and that means that gives us an opportunity to do something more there to change it, make a course correction, and commit to an ongoing process for improvement, because it doesn't end. It's always ongoing. So I know we're getting about the 5-minute or so time frame. So maybe what we can do is kind of stop there and see if you have questions, comments, things of interest. And again, I tried to make sure I included references in the slides, and they'll be available so that you can use those to look for those resources. I wanted to give you some tools that you can then use later to follow up on. And we're moving the microphone around to make sure we capture.
Well, thank you both for the presentation. So the question I have is regarding sensitive PII data. You mentioned you have that. So obviously with PII data, you want to limit access only to those that should have access. But in terms of audit trail, how do you manage that in the DHCS?
So to reframe the question maybe a little bit and then expand on it a little bit. So at Healthcare Services, we have a tremendous amount of personal information, personal health and protected health information, and we have that in our data repositories and our analytic platforms. And so we manage that in a variety of ways in terms of both training for folks that are going to have access to it, permissions, role-based permissions in terms of what people are allowed to have. So those things are handled within the organization. In terms of data release outside the organization, we actually have a fairly robust process around how we do data releases in terms of documenting who it's going to, why they have authority to receive it, doing quality assurance around how we do that data release. We've learned from past experiences, so we have a fairly rigorous process in doing that. For confidential data. For publicly released data, we use our data de-identification guidelines. So we've actually had those guidelines in place for a couple of years now and updated them with the agency guidelines that were released this last fall. And that gives us a nice process around what does it mean to make it de-identified and thus publicly releasable. And that's something that's really important, again, protecting the confidentiality of those we're entrusted to take care of. And so we use that, and that has helped tremendously to, again, have a more standard conversation and to really introduce more language around that. And it helps, too, in terms of having conversations with stakeholders, media and such. They say, well, why can't you give us this data? And we say, well, because here's our guidelines, and this is what we're looking at, and this is how we weigh it out, and we're not comfortable providing it to you. because we cannot be confident it's de-identified. So those guidelines really help us have that conversation. Also to be able to say, well, we can't do this, but we could do it this way. We can break it apart and report it in this way and then make it publicly available. So that has been a huge aid in terms of how we address PHI and PI. Within our automated systems internally where the confidential information sits, a key aspect there is having audit trails, audit tools around the data that's there so that we can run reports and see who's accessed what and such. And that's an internal control.
So I'll just add one more thing on that. So one of the things we do is you have to engineer in right from the beginning how you are going to anonymize the data immediately on ingest. You have to be able to tokenize it and encrypt it immediately as you're acquiring the data. Because once you allow data to sit on any IT system, you're vulnerable. You're vulnerable to somebody grabbing a hard drive, walking away with it, identifying the information. So you have to actually do that right in the beginning when you're getting the data in. And then based on role-based permissions, you give them the keys to unlock that data so that the people who have to see it can see it. And if they don't have the permission, they don't see any data. This happened to several large healthcare providers in the Midwest where they had analytic platforms and they had PII data in it. It wasn't tokenized and people's identifications were released inadvertently because somebody stole some drives from a big system. A lot of these big systems for analytics and big data, these kind of things are taken for granted. They get durability through replication. They don't really encrypt data. They don't do a lot of things because it affects their performance. So you have to do that, and that's one of the things that we're uniquely able to do is have that data encrypted at rest and also tokenize it on ingest so that you can make sure that even if somebody were to do something crazy like walk out of an IT infrastructure with drives, they can't read it. You know, that's important. All the policies in the world can't stop you from theft.
Right. So the goal is to have both processes to help protect as well as policies so that, you know, unfortunately, as humans, we do make mistakes. We don't mean to. So to the extent that you can have other procedures in place that help protect against that, you get that double layer, and that can really help as well.
And it's designed in.
Yeah.
If you don't take account of it in the beginning, it's hopeless.
Yep. One more question? Any other questions? I see a question back there.
So earlier you were talking about, you know, not chasing data for the sake of data, but
Right.
figuring out how you're going to analyze it and use it. Could you give some examples of how you've been able to approach creating those questions, those components of what the end result would be when you get the analytics? So, for example, looking at business processes, some will be self-evident, they'll be pretty obvious, but there's also that opportunity for finding what you don't know today. Can you give some examples of what you've done, successes or failures, and some possible steps in that?
Yeah, so in the 30 seconds or less version, I think, I think we've done. There's so many examples. So again, thinking about performance measures and how we measure is almost a whole nother talk because there's transaction level measures, there's process measures, there's outcome measures, there's balancing measures. All of those things come into effect. And it's not uncommon to start off with some basic analytics that look at your frequencies and your basic performance. And that's actually, as government, I think that's one of the things we do the most. We report your standard frequency tables without a lot of statistics involved. It's just this is how many of these things occurred. And that's what we do a lot of. And then the question becomes, well, what else does that mean and how does that relate? And that's where I think a lot of us are being asked and we're hopefully eager to pursue is, okay, great, now that we know this is what happened, here's your frequencies, your standard counts of how many people were born and of what characteristics. Now, what does that mean? So again, thinking about it as you're designing an intervention. So, one aspect, just using, because Tanya's here from our provider automation system, using that as an example, she talked about the fact that now that we're doing this monitoring, we're able to identify individuals who were already identified in another state that did something wrong, right? So we shouldn't be paying them or what have you. So there's things that are in that discovery arena. But when we think about analytics, often when people are coming in with analytics tools, again, think about the question. Well, what is the question I want to answer? I want to catch somebody who shouldn't be delivering services. That is a question to answer. I want to be able to measure and show the success of an intervention. That would be another thing. So we had a policy change that required treatment authorizations for the use of antipsychotics in all children, and we saw a decrease in the use of antipsychotics. We had a way that we could measure that before and after, and then we can say that intervention had an impact. There's still a whole nother debate that might occur whether that's an appropriate impact or not, but that was the goal and that was the impact we saw. So thinking about where you're trying to get to and what you want to measure, anytime you're doing an intervention, anytime you're changing the way you work, how are you going to be able to prove that it made a difference? Start thinking about that at the front end, because if you think about it at the back end, then you may not have the data, you may be not able to do it. You might get lucky, but it's better to think about it up front. So. Yeah.
One thing I'd add is that you should just make sure you acquire all the data, because as you pointed out, you don't know what the question is to ask. And if you start throwing data away inadvertently because you think it's inconsequential, you might be giving up some critical information that you actually need. And that's the whole promise of what we call a data lake in the analytic space, is that you want it to be basically Switzerland. You want anything to come into the data lake. You have to make sure that you're always testing the quality of the data, because that can really transform that data lake into something unusable. So data quality in a data lake is paramount. But once you have that, then as the questions come up, or the insights that you want, or the correlations that you want to ask, you have the data there that you can ask it. So it's important to not set walls in place, acquire the data, protect it, anonymize it, everything you need to do, and then start worrying about the questions. Because as you pointed out, you don't know what to ask yet.
And so here's the fun part. You're getting somebody who's non-government government. I'll say from the government side, we don't have that luxury. We actually have to try to say, what are we going to do with it before we collect it, because we have to justify the expense of every bit of data that we're collecting. So I think one of the things that you've got into here as well is some of that contrast in terms of where you sit, where you might have to be, and so we definitely have to think about that as we move forward, and gives you good food for thought. So hopefully we've given you some tools, and appreciate you coming out.
Thanks for your time.